Quarantine-free air travel between Singapore and Malaysia will resume from the end of the month. The new vaccinated travel lane between Changi and Kuala Lumpur international airports will begin with 6 flights a day. Both countries are working on a similar scheme for land travel, with leaders on both sides reporting good progress. Gwyneth Teo with more.
The world's busiest air route is about to be restored for general travel. For the first time since March last year, people in Singapore and Malaysia will be able to fly between the countries without being isolated on arrival.
Malaysia is our closest neighbour. Our two countries are deeply intertwined with long-standing economic and people-to-people ties. Undergirding these ties is the close connectivity between our countries. Families have been separated for many months and businesses have been affected.
Authorities are now focusing on doing the same over the country's land borders, which saw 300,000 people cross both ways daily before the pandemic. This, they say, will depend on the public health situation in Johor and Singapore. Discussions are also underway with other neighbours.
What is noteworthy is our own region, Southeast Asia. The pandemic situation is fast stabilizing. We will therefore be adjusting the risk classification for several ASEAN countries. This gives us scope to start opening up our borders with regional countries as well.
Beyond the region, quarantine-free travel has been extended to Finland and Sweden. It takes the number of countries under Singapore's VTL scheme to 16. 6,000 travellers may enter Singapore each day under these arrangements. That's around 8% of daily passenger arrivals at Changi Airport before the pandemic. Talks are ongoing with more countries in the Middle East and Asia Pacific.
The experience with the VTL scheme has given us the confidence that we can reopen our borders safely. As of the 7th of November, close to 18,000 travellers have entered Singapore via the vaccinated travel lanes. Of these, 17 have tested positive. This is about 1 imported case per 1,000 VTL travellers.
And in a further easing up of the rules, arriving and transiting passengers may use rapid tests instead of PCR tests, as long as they are done professionally. The new rule is for countries in categories 2 and 3 of the country's Safe Travel Scheme.